Throughout history, pregnancy has been treated like an illness. Recommendations for physical activity during pregnancy were based less off of science and more on social-culture ideas and norms. In the 40s, most books proclaimed that pregnant women could continue their housework and gardening, could walk up to 1 mile at a time, and occasionally could go for a swim. However, at this time, it was largely discouraged to do any sports activities. It was recommended that women should relax and avoid too much exertion or bending and stretching so that they do not harm the baby. In the 1960s and 70s, science became more involved in researching exercise as a component of health, and exercise became more popular among the general population. However, it was still announced that exercise, with the exception of walking, was still not recommended for pregnant women. During the late 1980s, a variety of exercises took off and pregnant women were finally involved in them as well. The first guidelines for exercise during pregnancy were released in 1985 by the American Congress of Obstetricians and Gynecologists. The recommendations were very cautious, restricting strenuous activity to only 15 minutes. It was recommended that their heart rates would not exceed the limit of 140 beats per minute, and that their core body temperature were kept below 100.4 degrees Fahrenheit. In 1994, the guidelines were reviewed and the heart rate and time restrictions were removed. Another revision in 2002 encouraged pregnant women to follow general adult recommendations for physical activity. And recently, in 2015, another revision of the guidelines by the ACOG stated that all pregnant women without complications should take up aerobics and strength training exercises. Even if they weren't exercising before pregnancy, it's encouraged that they start during. In general, only 20.3% of American adults meet weekly exercise recommendations. Studies have shown that physical activity is low prior to and during pregnancy, and they also show that women tend to decrease physical activity during pregnancy. Exercise can have beneficial effects on maternal and fetal health in pregnancy. Studies found that exercise can help manage gestational diabetes mellitus, which affects about 1 to 4% of pregnancies in different circumstances. Physically active women have lower glucose levels in the 24 to 28 week oral glucose tolerance test. Women at 24 to 34 weeks were diagnosed with gestational diabetes were less likely to require insulin for the remainder of their pregnancy when they participated in resistance exercise. A recent meta-analysis revealed that women who exercised before and during pregnancy reduced their risk of gestational diabetes mellitus by 55% and 24% respectively. However, there were other studies and Cochrane reviews that suggest there isn't enough evidence to prove that exercise affects gestational diabetes mellitus significantly. Exercise may also help decrease perinatal depressive symptoms and possibly postpartum depression. Adverse effects of perinatal depression are impaired fetal development, preterm delivery, or intrauterine growth restrictions. Postpartum depression can affect mother-infant body bonding, infant feeding difficulties, and childhood obesity. Exercise theoretically can improve mood and self-esteem and improve body satisfaction. Many studies found a decrease in depressive symptoms for pregnant women who are physically active. However, the studies are inconsistent. One study says women who exercise 1 to 2 times per week, but no more, were less likely to report depression, while another study said women who exercise 4 times per week, but not less, were likely to decrease depressive symptoms. ACOG endorsed weight gain goals during pregnancy in 2013 from the Institute of Medicine. This goal is based off of women's BMI at her first visit. Women with a normal BMI should gain 25 to 30 pounds. Women considered overweight should gain 15 to 25 pounds, and obese women should gain 11 to 20 pounds. One study found that in normal weight women, 40% gained more weight than the recommended range, and 60% of overweight women gained more than the upper limit. Women who were enrolled in a 12-week program with 24 exercise sessions stayed within the weight gain guidelines compared to the 62% of the control group. Exercise during pregnancy can also decrease postpartum weight retention. Women who are low-risk pregnancies are able to do physical activities despite their level before pregnancy. Women with certain chronic medical conditions, such as cardiovascular and respiratory conditions, are considered high risk. Contraindications to exercise are also important to be familiar with. To name a few absolute contraindications: gestational hypertension, preeclampsia, incompetent cervix, bleeding during the second or third trimester, risk of premature labor, and placenta previa. Some relative contraindications are intrauterine growth restriction, seizure disorder, thyroid disease, and extremes of weight. A pregnant woman should outline her basic exercise regimen based off of her prior physical activity state. Contact sports are considered less safe to do during pregnancy for the potential of trauma that can be done to the fetus and woman. Any sports such as skiing and horseback riding where there is potential of falling can increase risks, and scuba diving should be avoided. Competitive athletes can usually maintain a strenuous training regimen throughout pregnancy and can resume their high-intensity postpartum training sooner than the less active women. It isn't uncommon for pregnant women to compete in big events. 17 athletes have competed at the Olympics while pregnant. It is important for the childbirth educator to provide accurate information and community resources about safety and benefits of exercise. It is also important for childbirth educators to become familiar with the current exercise guidelines to incorporate exercise education into their core curriculum. A study surveyed 93 practicing healthcare providers, which included MDs, DOs, and nurse midwives. 99% of the respondents believed that exercise during pregnancy is beneficial, and 90% of them recommended exercise to their patients. Most providers, however, lacked knowledge on the current exercise recommendations and insisted that women limit their activity intensity based off of recommendations that haven't been applicable for years. While there's still room for conclusive research to be done on significant benefits or risks for exercise during pregnancy, there has been evidence of some benefits from it. Communication with the healthcare provider and being aware of contraindications are all important for a woman to consider. There hasn't been any proven risks for women not to continue to start an exercise routine program during pregnancy, and it is recommended that pregnant women get the same amount of exercise as the general public does.